Hello everyone. So we present you with a series of short topic discussions at Dr. Nisha Garg's Dental Academy. So these are basically those topics which are considered difficult to understand and are frequently asked in the exam. Okay, so we are taking them separately from other topics. Okay, so the topic for today's discussion is force decay in orthodontics. So this is force decay, the decrease in force in orthodontics. Okay, so these questions are basically asked as the types of forces. Okay, in exam the question which will come will be the type of force that is being applied. Okay, so basically there are three types of forces which are applied, or we say that there are three types of force decay in orthodontics. Okay, so the first type of force decay is continuous. Okay, in this the force is maintained at some appreciable fraction. The important words here are appreciable fraction of the original from one patient visit to the next. Okay, so when the patient visits the orthodontist applies force. Okay, so there is an increase in the force as you can see in this diagram. Okay, and this force starts gradually decreasing, but still it doesn't become zero. So this is the zero mark. Okay, the force doesn't decrease to zero in this. Okay, so here what we can see is the force is maintained at some appreciable fraction. Okay, as you can see here also the force is maintained at some appreciable fraction and it doesn't decrease to zero. So this kind of force is continuous force. Okay, then is the interrupted force. Okay, so in interrupted force the force level decline to zero between activations. Okay, as you can see here the force here becomes zero. Okay, here also the force when the patient comes to the orthodontist applies force, there is increase in the force and gradually it becomes zero. Okay, so both these interrupted as well as the continuous forces are always applied by fixed appliances. Okay, you have to remember that such kind of forces these are given by the fixed appliances. Okay, in this the force becomes zero, and in continuous one what we have is the force is maintained at some appreciable fraction. So that is the difference between these two forces. Okay, now coming to the third type of force, that is the intermittent force. Now this is most important one. The questions are mostly asked from this type of force, that intermittent force level decline abruptly to zero intermittently. Okay, such as when a removable orthodontic appliance or elastic traction to the fixed appliance is removed by the patient and then return to original levels sometime later when the appliance is reinserted back. Okay, so if you see in this diagram the patient is applying the elastics or using a removable appliance and the force levels are gradually decreasing. Okay, and what happens is when the patient removes the appliance it suddenly becomes zero. Okay, so intermittently the force level suddenly becomes zero, and when patient reinserts it back then it again increases. Okay, so if we can see the difference between the interrupted and the intermittent force, here there is no gradual decline to zero, there is an abrupt zero force. Okay, when the patient removes the appliance there is just an abrupt zero force. Okay, if you see in this diagram there is a gradual decrease to zero. Okay, as you can see there is a gradual decrease. Okay, but here we do not see a gradual decrease. There is gradual decrease but not to zero, and when the patient removes the appliance it abruptly comes to zero. Okay, so that is the difference. So mainly the intermittent force is applied by the removable type of appliances, okay, which we can remove. Okay, like we have Holly's appliance or any kind of acrylic plates, elastics, headgears or face masks. Such kind of appliances, they are removable appliances, so they give intermittent force, and interrupted and continuous forces is generally applied by the fixed appliances. Okay, so I hope this topic is clear to you now. Thank you.